Funds Exam 1 Review. Unit 1, Chapter 2, Health, Illness, and Stress. 1. Define acute illness. An acute illness is one that develops suddenly and resolves in a short time, e.g. flu. 2. Define chronic illness. A condition that is long-term, like diabetes, CHF. 3. Define terminal illness. A condition that cannot be cured and expected to lead to death, often within months or few years. 4. Define primary illness. A primary illness is one that develops without being caused by another health problem. 5. Define secondary illness. A secondary illness is caused by a primary illness. 6. Define congenital illness, being caused by another health problem. An inherited or genetic illness or disease. 7 stages of illness. Transition stage. One may deny feeling ill but recognizes that symptoms of illness. Acceptance stage. Acceptance occurs as the person stops denying illness and assumes a sick role. Convalescence stage. Convalescence is the process of recovering after the illness and regaining health. 8. What are the variables that influence health? Religion, gender, geography, etc. 9. What is holistic approach? It is characterized by the treatment of the whole person, not just the symptoms of an illness. It includes the person's biological, psychological, sociological, and spiritual aspects and needs. 10. What is environmental health? Environmental health is different from holistic health. Environmental health examples like water, tables, noise, classroom, etc. 11. Health and illness behaviors. Health and illness behaviors are based on what a person knows and believes about health and illness and how one's health is assessed. 12. Healthy behavior. Healthy behavior can be defined as any action undertaken to promote health, prevent disease, or detect disease in an early asymptomatic, without symptoms, stage. 13. Illness behavior. Illness behavior is any activity someone takes to determine their actual state of health and to seek a suitable remedy for a health problem. 14. Maslow's theory of basic needs. People must satisfy lower-level needs before higher-level ones can be addressed. 15. Pyramid of Maslow's theory. Self-actualization. Achievement, talent, flexibility. Self-esteem. Independence, motivation, love. Safety and security. Comfortable environment, meeting needs. Physiologic. Food, water, hygiene, sex, activity. 16. Defense mechanisms. Defense mechanisms are strategies that protect us from increasing anxiety. Defense mechanisms reduce both anxiety and the secretion of stress hormones. 17. Define first, second, and third line of defense. Intact skin serves as a first line of defense against harmful environmental agents. The body's second line of defense helps destroy pathogens that escape the first line of defense. This includes the mechanisms of fever, leukocytosis, phagocytosis, inflammation, and the action of interferon. The immune response is the third line of defense against pathogenic organisms. Microorganisms and other substances that do not belong in the body, such as pollen, are recognized as foreign invaders and trigger an immune response. 18. Coping mechanisms to reduce stress and anxiety in patients. Explain everything. Listen carefully. Provide privacy. Treat with respect. Answer call light promptly. Keep noise to a minimum. 19. What is adaptation? To adapt is to respond to change. The systems of the body have self-regulatory mechanisms to maintain homeostasis. 20. Explain general adaptation syndrome, GAS. The body attempts to deal with stressors by secretion of hormones that cause adaptive responses. 21 stages of GAS. Alarm stage. Resistance stage. Exhaustion stage. 22. Define asepsis. Asepsis is the practice of making the environment and objects free of microorganisms. 23. How many types of asepsis are there? There are 2 types of asepsis are practiced within healthcare agencies. Medical asepsis. Medical asepsis is the practice of reducing the number of organisms present or reducing the risk of transmission of organisms. It prevents reinfection of the patient and the spread of infection from person to person. It is also referred to as clean technique. Surgical asepsis. Surgical asepsis is the practice of preparing and handling materials in a way that prevents the patient's exposure to living microorganisms. It involves the sterilization of all instruments and inanimate equipment. It is also referred to as sterile technique. Exam 1 Review. Unit 2, Chapters 17 and 18. 1 pp. Personal protective equipments, items, supplies. Head cover. Mask. Eyewear. Isolation gown. Shoe cover. Gloves. 2 pp. Donning, putting/wearing, order. Gown. Mask. Goggles or eyewear. Gloves. Perform hand hygiene. 3 pp. Doffing, removing, order. Gloves. Goggles or eyewear. Gown. Mask. Perform hand hygiene. For isolation precautions. Airborne precautions. Droplet precautions. Contact precautions. 5 airborne precautions. Prevent the spread of diseases transmitted through the air, E.GTB measles. 6 droplet precautions. Prevent the spread of disease transmitted through respiratory droplets when an infected person coughs, sneezes, or talks. 7 contact precautions. Prevent the spread of disease transmitted through direct or indirect contact with a patient or their environment. 8. What is cross-contamination? Transmission of infectious microorganisms from one person or object to another. 9. Who might be a susceptible patient? A patient may be susceptible because of age, state of health, or broken skin. 10 factors that increase susceptibility of infections. Age. Eyewear. Malnutrition. Excessive stress or fatigue. Low leukocyte WBC count. Alcohol use disorder. Chronic illness. Indwelling tubes. 11 chain of infection. The process by which an infection is spread from one person to another is considered as chain of infection. 12 links/ways of chain of infections. Causative agent. Bacteria, virus, fungi, etc. Reservoir. Places where microorganisms are found, E.G. infected wound, human/animal waste, etc. Portal of exit. Route by which a pathogen leaves the body of its host, e.g. GI tract, respiratory tract, etc. Mode of transfer. Include 1. Direct contact with body excretions/drainage, e.t. Infected wound. 2. Indirect contact with contaminated inanimate object, E.G. needles, dressing. 3. Vector, E.G. fleas, ticks, mosquito. 4. Droplet infection. 5. Spread of infection from one part of the body to another. Portal of entry. Routes like mucous membrane of the eyes, nose, mouth, trachea, or skin, through which the pathogens can enter the body. Susceptible host. A human host may be susceptible because of age, state of health, or broken skin. Older adults at high risk of infection. 13. How you can break the chain of infection. Following are the ways and interventions to break the chain of infection. Link/source. Way to break. Interventions. Causative. Agent. Elimination of microorganisms. Disinfection, sterilization. Reservoir. Prevent transfer of microorganisms. Hand hygiene, PP. Porta of exit. Prevent contamination. Hand hygiene, PP. Medical asepsis. Mode of transfer. Prevent contamination, eliminate vectors. Standard and transmission-based precautions. Portal of entry. Protect skin, protect mucous membrane, put only clean things in mouth. Good hygiene practice, skincare, PP. Susceptible. Host. Protect natural body defenses. Promoting natural body defenses, hand hygiene. Exam 1 review. Unit 2, Chapters 21. One-time panic oral and axillary thermometer. Tympanic ear. Oral forehead. Axillary armpit. To use of a glass thermometer. A glass thermometer is never used orally if the patient is uncooperative or at risk of biting on the thermometer. 3 list pulse points. Temporal. Cartoid. Apical. Brachial. Radial. Femoral. Popliteal. Posterior tibial. Dorsalis pedis. For what are the organs of respiration? Nose. Pharynx. Trachea, bronchi, and lungs. 5 stages of fever. Onset. May occur gradually or suddenly. Febrile. Body temperature rises to the new set point established by the hypothalamus and remains there until the cause of the fever resolves. Defervescence. Lowering of the body temperature to normal. The person feels warm and the skin may be moist. 6. What is SDS and what does it contain? SDS Safety Data Sheet is a document that provides comprehensive information about a hazardous chemical, including its properties, potential hazards, safe handling procedures, and emergencies measures. 7. How to provide a safe environment for patients? By applying following practices. Patient and family orientation. Assess patient's gait and risk for fall. Evaluate patient's medication for side effects. Keep the bed in the lowest position. Keep the mattress or low platform in case of fall risk. Toilet the patient on a regular schedule. Lock the bed wheel to prevent the bed from rolling. Provide a nightlight. Apply firm, non-skid slippers. Answer call lights quickly. 8 poison control measures. Never call medicine candy. Keep toxic substances in a locked cabinet. Always keep toxic substances in their original labeled container. Keep the poison control number 800-222-1222. Never induce vomiting unless instructed to by a professional. Older adults' medications should be kept in a locked cabinet, particularly if young children visit. 9. Fire safety. Fire is a possibility in any setting. You must know and be familiar with your institution's fire regulations. 10 basic types of fire extinguishers. Type A. Used for fires caused by cloth, wood, and paper. Type B. Used for fires caused by combustible liquids, gasoline, oil. Type C. Used for fires caused by electrical equipment, tools. Type D. Used for fires caused by flammable metals in factories. Type K. Used for fires associated with cooking, kitchens. 11. Acronym PASS. The acronym PASS serves as a reminder for using a fire extinguisher correctly. Pull the pin. Aim at the base of fire. Squeeze the trigger. Sweep side to side. 12. Acronym RACE. Rescue any patients in immediate danger by removing them from the area. Activate the fire alarm system. Contain the fire by closing all doors and windows. Extinguish the flames with an appropriate extinguisher or evacuate. 13. Poison control measures. Never call medicine candy. Exam 1 review. Unit 2, Chapters 20, Hygiene. 1. Elderly consideration. Older adults have an increased risk of developing altered skin integrity from normal aging changes. They have thinner skin, decreased subcutaneous fat, decreased sebaceous gland activity, and decreased elasticity in their skin. These changes make the older adult less able to tolerate pressure, shearing, and friction forces. 2. What are the purposes of bath? Bathing has 4 basic purposes. I. Cleanse the skin. 2. Promote comfort. 3. Stimulate circulation, and 4. Remove waste products secreted through the skin. 3. How many types of baths are there? A bath may be I. Complete bath. With a complete bath, all areas of the patient's body are washed. 2. Partial bath. Only certain parts of the patient's body are bathed, such as the face, hands, axillae, back, and perineal area. 3. Cleansing bath. The most common type of bath is a cleansing bath. It is generally provided in a bed, tub, or shower. Bed baths are given to patients who are unable to use a tub or shower. 4. Therapeutic bath. Therapeutic means having healing or medicinal qualities. Therapeutic baths are performed to achieve a desired effect. Whirlpool bath. Whirlpool baths are used to cleanse, stimulate peripheral circulation, and provide comfort. A whirlpool bath is done in a bathtub or special whirlpool tub that has a device that agitates the water. The heat of the water and agitation gently massage the skin. Starch or oatmeal bath. Starch or oatmeal baths, using plain instant omea, are used for patients with dermatitis. Sitz bath. Sitz baths are used to apply moist heat and clean the perineal or anal area. Sitz bath promotes healing and relieves pain and discomfort. It is commonly used after birth and vaginal or rectal surgery. For what is oral or mouth care? Mouth care removes food particles and secretions, which prevents halitosis, bad breath, feelings of uncleanliness, and dental caries, cavities. Oral hygiene promotes a better appetite and maintains the healthy state of the mouth, gums, teeth, and lips. 5. Explain mouth care, oral care. For the conscious patient, raise the head of the bed 45 to 90 degrees. Wear gloves when providing or assisting with mouth/oral care. If the patient is unable to sit up, turn the patient to the side facing you. Place a towel under the chin. Moisten the toothbrush with water and apply toothpaste. Brush from the gum line to the edge of the teeth. All surfaces of each tooth should be brushed. Have the patient rinse the mouth and spit the solution into the emesis basin. 6. Explain mouth, oral. Care for the unconscious patient. Provide full mouth care to an unconscious patient at least once every 4 hours. If the patient is mouth breathing, perform every 4 hours. Mouth breathing causes the tongue to dry and become crusty. Remove and dry secretions because they cause halitosis, bad breath, and may obstruct airflow. Perform moist swabbing of the mouth every 2 hours or as needed to maintain the integrity of the oral cavity. 7. How to perform bath to elderly residents/patients. Because of decreased sweat and sebaceous gland activity, a full bath is not needed every day. Personal preference must be considered. Because of thinner skin and decreased subcutaneous fat, chilling is more likely during the bath. Prevent this by pre-warming the bath area and providing adequate draping. Older adults have less subcutaneous fat, and their skin is more fragile and drier. Use warm, not hot, water and minimal amounts of mild soap. Rinse thoroughly and thoroughly pat dry to minimize skin irritation. Bath oils may be used, but special care needs to be taken to prevent slips and falls. 8. Do you have to use soap every day while bathing elderly? Soap is not generally used on older adult skin every day. On alternate day, use soap only on areas visibly soiled. Older women who cannot reach and bend easily need to have the nurse perform perineal care. Rather than giving this patient a choice, say, "I'm going to clean the areas that are difficult to reach." If the patient protests, allow her to wash herself. Exam 1 Review. Unit 3, Chapters 22, Vital Signs. 1 Factors that affect body temperature. Time of the day, circadian rhythm. Environmental temperature. Patient's age. Physical exercise. Menstrual cycle and pregnancy. Emotional stress. Disease conditions. Drugs. 2 types of thermometers and when are they appropriate to be used? The temperature reading obtained varies according to the site used. Measurement sites are the mouth, rectum, axilla, armpit, ear, and skin. Most temperatures are measured orally, rectally, via the tympanic membrane, eardrum, or via the temporal artery. 3. When you cannot use glass thermometer? A glass thermometer is never used orally if the patient is uncooperative or at risk of biting on the thermometer, such as if they have seizure disorder. For older adults, elderly, body temperature, patients older than age 75 tend to have a lower base body temperature. A frail older adult often may have a base temperature, 97.2 F. If an elevation of 2 F above baseline occurs, fever is present. 5 stages of fever? Fever occurs in 3 distinct stages. I. Onset. Onset temperature may occur gradually or suddenly. 2. Febrile. During the febrile stage, the body temperature rises to the new set point established by the hypothalamus and remains there until the cause of the fever resolves. 3. Defervescence. In this stage of fever, a period comes when the temperature typically decreases or lowers between days 3 and 7. Exam 1 Review. Unit 3, Chapters 19, Positioning. 1 Low Fowlers, Semi-Fowlers, High Fowlers, Supine, Prone, Lateral lithotomy. Definition. Position. Standard Fowler's position, also known as sitting position, is typically used for neurosurgery and shoulder surgeries. Semi-Fowler or low Fowler position is a supine position in which an individual lies on their back on a bed, with the head of the bed elevated between 30 to 45 degrees, and the legs of the patient can be either straight or bent at the knees. High Fowler's position is a patient positioning technique where the head of the bed is elevated to a 60 to 90 degree angle, essentially sitting the patient upright. The supine position refers to lying on one's back, with the face and torso facing upwards. The prone position is a body position where an individual lies flat on their stomach, face down. In anatomical terms, the dorsal, back, side is up, and the ventral, front, side is down. The lateral position, also known as the lateral decubitus position, is a patient positioning technique where the individual lies on their side, with the head elevated to align with the spine. The left lateral recumbent position, also known as the left side-lying position or recovery position, is a patient position where the individual lies on their left side with their left arm extended along their side and their right knee bent and drawn up towards the chest. The lithotomy position is a common medical position where a patient lies on their back with their hips and knees flexed and their legs supported in stirrups or other supports. The dorsal recumbent position is a body position where a person lies on their back with their knees bent and feet flat on a surface. The knee-chest position, also known as genupectoral position, is a posture where the individual rests on their knees and chest with their buttocks raised. The side-lying oblique position is where the body is supported on one side with the legs stacked or slightly staggered. Terminology. Term. Meaning. Apprenticeship. Learning by doing. Interventions. Actions taken to improve, maintain, or restore health. Invasive procedures. Procedures that require entry into the body. Aseptically. Without introducing infectious material. Nursing theory. A statement about relationships among concepts or facts based on existing information. Nursing process. An organized, deliberate, systematic way to deliver